Hello, everyone. Welcome to today's webinar. We're going to be getting started in just another minute here. And while folks are getting logged in, I'd just love to welcome you on behalf of the NIOSH Center of Excellence for Total Worker Health at the California Labor Lab. A few housekeeping items. You are going to be muted during today's presentation. If you'd like to ask a question, we welcome you to enter it into the online Q&A box. We prefer the Q&A box over the chat function, as it just makes it a little easier for our moderators to keep track of what has been asked and answered when you use that Q&A. We'll be saving time at the end of the presentation to address as many questions as possible. This presentation is also being recorded and will be made available on the California Labor Lab and Center for Occupational and Environmental Health YouTube page. And all participants who logged in with their registration email via Zoom for the full live presentation today will receive an email tomorrow with a link to an evaluation form. Once you complete that form, you'll be qualified for a certificate of completion worth 1 continuing education contact hour. And after you submit that form, you'll be able to access and print your certificate. And with that, I'm going to hand it over to Dr. Ed Yellen.
Thanks, Michelle. And it's a distinct honor to have Dr. Sorensen as our speaker. She has directed the Harvard Center for Work Health and Well-Being since its inception. It was one of the original total worker health centers focused from NIOSH, and we are a newbie and have learned much from our colleagues who preceded us with the center. Before I introduce Dr. Sorensen a little bit more, I would like to just remind everyone that we have our next webinar on March 22nd with Jenny Weisbord from the Family Work Fund, who's going to be talking about job quality and the measurement issues that they've been working on there. And also to remind everyone that we have our annual virtual 2-day conference on May 2nd and 3rd. This year it's on surveillance, monitoring, and data gathering in contemporary employment. And we think we have a stellar lineup over the 2 days. So please go to our website to register, or for those of you who have been attending our events, you will get information to register as well. So Dr. Sorensen is a really great person to have today because the Harvard Center, I think first among all of the centers, was the one that recognized that getting to healthy workers involves more than training workers for resilience. It's all about understanding the structures that cause workers to become ill or less than well. And we agree with her orientation and that of her center, that the organization of work is a much more important factor than whether or not an individual adheres to some of these guidelines for personal behavior. So that was an important change in the total worker health program. And I think NIOSH itself has recognized it as its own thinking has evolved in large measure, I think, because of the work that's been done by Dr. Sorensen and her colleagues at the Harvard Center. So she is, in fact, the director of the Center for Work Health and Well-Being. It's a consortium of Harvard, Northeastern, Boston College, and MIT. She also, and this is almost a cliche, if you want something done, get a busy person to do it, is the director of the community-based research at the Dana-Farber Cancer Institute. She has a PhD in sociology and as an MPH. And so she combines 2 very important perspectives in understanding why workers may become unhealthy, the role that organizations play in them. And so without further ado, Glorian, the mic is yours, and we appreciate so much your taking your time for this.
Thank you, Ed. That was a very generous introduction. I appreciate it very much. And I'm delighted on behalf of our center to be participating in a webinar brought to you by our sister center, the California Labor Lab. We're both part of the NIOSH efforts to, it was working a few minutes ago. There we go. We're both centers part of the effort by the National Institute for Occupational Safety and Health called Total Worker Health, which is the definition is here. It's the policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness in order to advance worker well-being. I'm going to get into this a little bit more today to say what do we actually mean by all of this concept, but I think what Ed just mentioned in terms of the efforts to really think about organizational change as really the starting point for much of the kind of work that we do. So what I'm hoping to accomplish today in our session together is, first of all, to provide a little bit of a rationale and conceptual framework for why it is useful to even take an organizational approach around protecting and promoting worker health. So rather than thinking only about individuals, why think about the whole system? Then to describe some key principles around how we might implement this kind of an approach and actually evaluate it as well. And then I'm going to present one case study from our own work based in the food service industry to actually look at this a little bit more. So just to start with a little bit of background, this is an older slide, but I present it here because I think this remains very much a standard model for thinking about workplace health protection and promotion in many organizations. And what I'm trying to get at in this slide is this kind of siloed approach where these different functions are situated oftentimes in different departments within an organization. So you might have an area where you have supporting healthier behaviors through maybe the workplace environment, such as screening services or related kind of efforts, which is often done very distinctly and differently from the areas that are dealing with safety and control of workplace hazards. That may be again different from stress-related initiatives, decreasing stress, which is often part of, maybe it's part of the HR department or other kind of related departments, but you can see that this is a more siloed approach where there's oftentimes very little coordination across these different functions. So what we're talking about here is moving away from this usual siloed approach, which oftentimes ends up focusing on individual outcomes, to thinking more about a systems approach where there becomes collaboration across these typically siloed units. And together they can begin to look at upstream root causes that are often situated in the conditions of work within an organization. So this is really thinking, rather than an individual approach, the population of workers within an organization. So let's take a moment just to kind of, as we're chatting today, to think about where your own organization might sit within this kind of a continuum and where you might want to be as you're considering some of these thoughts as we look at organizational change and the potential that organizational change can have for worker health and well-being. What I'm going to try to present to you today is that, first of all, working conditions are oftentimes the root causes of poor health and safety outcomes, and that improving these working conditions can actually be a way of optimizing these health outcomes. So what we're looking at then becomes more of an upstream systems approach that really can contribute to the culture that we have. So thinking beyond the individuals, thinking about how individuals might be situated within that broader culture. Now, when I'm talking about working conditions, I mean that fairly broadly, as you can see in this slide. oftentimes when we're in public health or in work organizations, we start by thinking of the physical kind of working conditions, the safety hazards or the potential physical hazards that a worker might be exposed to. But when we think about working conditions, we're trying to go beyond that to think additionally about job demands and how a job might actually be formulated in terms of what a person needs to do and how much kind of resources a person has in doing in addressing those kind of job demands. We might also think about these psychosocial hazards that might be stress related, it might be relationship related. How's the level of supervisor support? Do people feel any sense of discrimination in their work environment? Is it a supportive workplace? And then organizational factors as well may come into play. What kind of policies are already in place to help protect worker health outcomes? So to think about this more broadly, stop for a moment and think about how this might look within your own work setting. And I'd like to give you an example, focusing particularly in a healthcare setting and thinking about how workers might respond to working conditions if they were going to actually do one kind of activity, which is mobilizing a patient, which we know is a very important piece in terms of protecting worker health outcomes related to injuries and other issues. So if we started with the physical working conditions, we might ask, is the equipment even there to actually do the kind of movement or mobilizing of the patient that we might actually want to think about? But in addition, beyond having that equipment, is there even time to use it? Or is there instead such a strong pressure around time demands and the need, obviously, for addressing patient care that there's not really any time to actually use the equipment? We might also ask, has the equipment been prescribed for this kind of a use? Have workers been trained in the use of this kind of material, this kind of equipment? And then also important in this are some of the psychosocial factors, such as whether or not supervisors are even encouraging workers to use this equipment. So when we think about these working conditions and how they might impact workers, we can think very broadly across these different types of conditions of work. Within our center, we've tried to take this into a conceptual framework that places these working conditions kind of in the middle of our thinking, so that we're really recognizing that these different types of working conditions can clearly influence worker outcomes like injury and illness, but they also have an important impact on enterprise outcomes such as productivity, turnover, healthcare costs, and may even have effects on health behaviors that we often address in like health promotion efforts. So all of these go back to these policies, programs, and practices that we may design and implement through what we might think of as our interventions to actually shape some of these working conditions. We like to use these kind of conceptual models because it gives us as a team of researchers and also practitioners a common vision for where we're headed and a shared kind of understanding of the principles and priorities for interventions. From a research perspective, it frames our research directions and our research questions and even gives us a framework for the kinds of analyses that we might want to do. In our own thinking within our center, we've actually even taken that conceptual model another step further to actually go beyond this sort of enterprise and worker level and to recognize the ways in which the enterprise might be situated in broader labor patterns or employment patterns, policies that are maybe at a societal level that might fit into this broader social, political, and economic environment. This isn't only our thinking. This next slide is actually something that NIOSH has put a fair amount of time in thinking about, that as we look at issues related to advancing worker health, we can think about these kind of policy issues, the kind of changing dynamics in terms of employment patterns that those of us who are interested in work have clearly seen as COVID has changed the way that work is organized. It also may move into these environmental supports that might be supported through some of these community level efforts, as well as when we get to the more environmental factors, thinking about these other factors that we've been thinking about. When we think then about organizational change, if we moved kind of to this area here of really thinking about what happens within the organization, how is it that we want to promote change, we really take a management systems approach that's really shaped in many ways by worker input and participation. We obviously need to start by making sure that there is a safe work environment. And with that, we're building very much on traditional approaches to health protection and occupational safety and health, as well as efforts to promote worker health in other ways through coordinating across these silos that we talked about, these separate policies and programs to create a more coordinated effort across these different functions within an organization. This means that some of our policies and practices might be shaped together in unison to really help us think about organizational change and the way organizational change can really impact positive working conditions. We recognize, of course, that this happens on a continuum. This is sort of for many, it might be somewhat aspirational to think about all of this coordination, but small steps along the way can make a real difference. The Total Worker Health Program at NIOSH has also adapted a hierarchy of controls model that's typically used within occupational safety and health. Within the hierarchy of controls kind of framework, what it says is that what we want to do is start with the most kind of way of reducing the potential for exposure to a hazard overall. And so from a total worker health perspective, we broaden that perspective of a hazard to really think about working conditions across those different types of working conditions. So how can we eliminate working conditions that may be a threat to worker health and well-being and safety, not only the physical working conditions, but those others that we mentioned. We might want to substitute health enhancing policies and programs, redesign the work environment. And so these efforts that are really targeting education and encouragement of individuals are really down at the lower level of this hierarchy, only when we're not able to address some of those concerns at that broader level, because what happens when we're able to eliminate the hazard from the very beginning, we don't even have to worry about going on a person-by-person basis. We're changing even the potential for that exposure. So let's turn then to, what does that mean? How do we apply a change process in all of this? And for many of you who are working in different kinds of employer settings, I'm sure that you're familiar with this Plan, Do, Study, Act framework that is typically used for implementing any kind of change within an organization. And it's no different here. We're talking about the same kind of a framework of really thinking about the planning up front and what kind of information is needed based particularly on that sense of leadership commitment and support. And with that kind of effort from the very beginning, we move into that do phase and kind of beginning implementation, maybe testing out the waters, collecting some information, and acting on the basis of that process. And this participatory process along the bottom is a really critical component of the whole change effort. The participatory process is really important because it means that it gives us a way to optimizing fit. So if you're in a given organization, you may have a pretty good understanding of the whole organization, but there might be a need for shaping it within subgroups within that. Or if you're trying to work across organizations, optimizing fit in terms of change given the specific setting. And I'll talk a little bit more about that when we get into the case study. It also gives us a voice for multiple stakeholders across the organization. That obviously means workers, but it means middle managers, upper level managers, so that it begins to improve team functioning and communication, again, across those different silos that we talked about. How do we improve that communication and facilitate their involvement in the change process? This can be done maybe by an integrated team that might be building off of teams that are already in place. For example, if there's an occupational health and safety committee already in place, can that group have an expanded charge to begin to think more broadly about worker safety and health? Are there ways to engage other workers in that process? How do we respond then to the input that workers might have, and to give them some sort of a system for reporting their concerns, not only in terms of risks and hazards, but in terms of other priorities that they might see related to the range of conditions of work. So let's try to kind of put this in a little bit of a framework with a little thought exercise. And with this in mind, you might just give a little thought for your own organization about, what would be a priority pain point that you might have. So we might start over here with thinking about employer or employee outcomes that could be priorities based on, either some assessments that might have been done within the organization, or maybe review of data that you have that has really highlighted a particular need. And then we work backwards to say, what are the working conditions that function as root causes of those outcomes, and what kinds of policies and practices might help us implement or affect change in those working conditions. So here we've got an example of, say, reducing back injuries and related costs to those. So it might be that assessing some of the job functions, like moving heavy items, or maybe it's back to the little example that we gave of mobilizing a patient. How do the working conditions set up a situation that might increase the potential for back injuries? And then how might those policies, such as having a mechanical lift plan, actually begin to create improvements in some of these working conditions? So it gives us a way of really thinking about the organizational strategies that might be put into place to improve working conditions. In our work and pulling from the literature more broadly, we've focused on a few characteristics, some of which I've already mentioned, starting with this kind of idea that we're focusing first and foremost on these working conditions that may really be supportive of worker health outcomes using this kind of hierarchy of controls model. We've seen throughout the literature that leadership commitment and their vision can really create an understanding that this is of value to the organization, that that the communications around this are consistent, and it establishes as well an accountability for the actions that might be taken. Beyond, however, or in addition to, not however, leadership commitment, we obviously need that participation across all levels, giving workers and organized labor a voice in the decision-making process. And part of that is also here beginning to think about how we might take this approach of looking across these different functions or silos within the organization and creating improved collaboration and coordination across those different functions within the vision provided by leadership for this shared goal of worker health, safety, and well-being. It may mean some attention to evolving standards around prevention and control. Some of these might be specific legislative efforts that pertain to particular industries, for example. And then we also know that that evaluation, that plan, do, study, act cycle that we talked about relies very heavily on data-driven change. And it gives us a way to monitor the progress that we might have over time and make mid-course corrections along the way in order to have better quality outcomes. Give me a moment here. So let's just stop for a moment and think about the evidence. How will this work? There's a growing literature around the importance of this kind of an approach. My own work began on this a long time ago, actually. In one of my very first studies, my dear colleague Jack Dennerline decided to pull this little picture for me at one point because the little anecdote happened in a foundry. One of my first studies that I was doing was a smoking cessation study in work sites. And one of the places that I was working was a foundry. And talking to an older man in the foundry about quitting smoking, he turned to me and said, "Why should I quit smoking? I'm just exposed to all these fumes. It doesn't really matter." And it began to kind of dawn on me that obviously workers are very well aware of their working conditions. He knew his exposure. And so one of our first studies in this area actually focused on trying to test out what would happen if we added occupational safety and health effort to a more typical health promotion tobacco control initiative. So we did a randomized controlled study over time to compare these two different kinds of interventions. And interestingly, we compared this by hourly versus salaried workers. And the hourly workers are really the blue collar workers who were most at risk for the exposures to hazards on the job. And what we saw here is that, so the gold color is the integrated kind of health promotion and occupational health piece, and the other one is the health tobacco only. And what you can see here is that among blue collar workers, those in the work sites that received the combined intervention actually had a doubling of the impact on smoking cessation. This is for all of the tobacco users in the company, not just for any that participated in any programs. Versus for the salaried workers, although this looks like a difference, it's not a statistically significant difference. It didn't really matter whether we brought in the occupational safety and health piece, mostly because the salaried workers really weren't that exposed to any job hazards anyways. So what we found in this early study is that really tobacco use cessation increased for blue collar workers in this kind of combined approach, where we started to think about changes not only for the individual, but for the broader work organization, especially in terms of hazards on the job. We also saw that it also increased participation rates, both among workers and managers, and brought as well improvements in occupational health programs. This was an earlier study. So much has been added onto this since this early time of doing that research. And I've included just a few references here, which we're happy to share with you. But what we're seeing more and more is that organizations that are using a total worker health approach actually many have actually reported improvements in their financial market performance. This is the work of Ray Fabius, which is listed here, which he's, I believe, updated since then. But it also has been shown to lead to healthier workplaces, to actually boost productivity and satisfaction while lowering turnover rates, improving employee participation, and creating stronger programs, whether we're looking at health and safety programs or those related to behavior change. So this, although this is still an emerging field in terms of total worker health, what we see in the literature is a growing sense of evidence that this approach really can make a huge difference in terms of worker health outcomes. So I'd like to turn now, making sure that we allow time for questions at the end, to a case study that just to walk through some work that we did in a food service setting. This was a study that was focused particularly on changing organizational factors within the food service industry. This is an interesting industry because this was actually, you can imagine food service cafeterias in businesses, maybe in a bank, for example, or a legal office, or you know, it could be similar to what you might see in a university, but these were smaller cafeterias in these workplace settings, so that there was a client. The client would have been the employer or the workplace that was hiring the food service, and they had a relationship with the food service organization to provide these food services, which were located and operated within the client facility. So it meant that the tasks were often dependent upon the needs of the client. Some of them, for example, had a lot more requirements for catering, whereas others were focused more on breakfast and lunch cafeterias. So in many ways, from our perspective, these were small workplaces that were embedded in a larger organization, that is the organization that provided food service. This is interesting because there is evidence, setting aside the food service industry, there's increasing evidence that many more companies are being are operating in this way, where there's a little bit of a remove from who's actually responsible for health and safety. Is it the employing organization, the place that pays their paycheck, or is it the place that actually controls the work environment, that is the client organization here? In this case, the job tasks were those listed here, you know, typical kinds of food service efforts and jobs that might involve particularly high physical and psychosocial demands, particularly at the kind of lunch hour or whatever. In addition, it's important as we think about different work settings to recognize that low-wage workers, those workers that were employed in these settings, often face a range of other issues that are related to job quality. Oftentimes, these are jobs with less job security, less reliability and predictability of the work hours that they might have, oftentimes fewer benefits, less reliability in terms of the breaks, and not as much opportunity for career advancement within the organization. Many of these workers had a second job. They additionally often had childcare responsibilities at home, and so they were juggling a lot of different things. And these are important factors that, as we're sort of thinking about conditions of work, we're thinking broadly about what are the factors and the context that's influencing the lives of the day-to-day lives of these workers. This was so just to give you a little bit of an overview, this was a 4-year study funded by NIOSH that was really meant as a proof of concept study to see whether or not making these kinds of changes would be feasible in terms of this kind of an organization in collaboration with this large food service company. And what we I can refer you here to some of our manuscripts that provide overviews of the kind of work that we did here. But returning kind of to the model that we had for initially talking about how do we make change, we started with a planning and needs assessment process that we talked, that planning process that we talked about. And in this case, it was done at 2 levels. So we started at a company-wide planning effort where we collected some qualitative interview, we did some site observations, and collected information, and then kind of pulled them together in what we termed a sense-making workshop in collaboration with workers as well as managers within these sites to say, based on what we've heard from our interviews and focus groups and site observations, surveys, what we're hearing these are some priorities. And together in this workshop, we determined that the intervention was going to focus on these 3 working conditions as critical priorities. So ergonomics and safety, work intensity, and job enrichment. Then when we went to the individual cafeterias, we did additional site-specific assessments to data collection, much less involved, to tailor this to the individual sites and to be able to inform what we're actually doing in the particular cafeteria settings. So you can see within this that we had kind of a multi-level engagement across different levels, recognizing the importance for feedback and input in the planning process across the different sort of stakeholders within the organization. We learned a lot in this process in terms of the way the context really matters. And we've been talking about that in terms of sort of thinking about these working conditions. We found, for example, that these client-related factors really made a difference. So what was the built environment like? What was the contractual parameters? For example, there were a couple of cafeterias where it was part of the contract that the client did not want the cashiers to be sitting at a chair. They wanted them to be standing because, I don't know, it looked better or something. So it made it more challenging to say, let's bring in some different kind of equipment to address some of the fatigue and feeling of back problems related to standing all day. We also saw organizational culture made a huge difference. There were a lot of competing priorities, particularly the time demands and also the pressures on these general managers who were the site managers of each of the cafeterias, who had to respond to their clients, but also to the upper level management within the larger food service organization. So these middle manager kinds of factors really played a heavy role in terms of our working with the cafeteria managers. It also shaped the extent to which workers could be involved if site managers were feeling especially overworked and having challenges in terms of just meeting their day-to-day responsibilities. So just to kind of refer you back again to how we adapted the conceptual model, again, thinking about how the conceptual model can really give us a framework for a shared vision of what we were doing. We built the working conditions in as a way of thinking about these are what we want to change in order to impact these outcomes. And based on the data that we collected as part of the planning process, we opted to focus on these essential elements of the intervention, which very much align with some of the critical characteristics that I talked about earlier. So what our intervention looked like is kind of like this. We had 3 different sequentially delivered modules, focusing each one at a time on these 3 working conditions. And we worked with the steering committee that was kind of at the district level to help us with planning and making sure that the interventions were aligned with the larger corporate initiatives and utilizing any potential resources that the corporate level might have. And then we worked with each of these 5 specific cafeterias to actually tailor the sort of module-wide efforts to each site based on the site assessment, the action plan and implementation strategies that we worked on with the site managers, providing consultation and training and technical support, and working with the managers to engage workers in the process. So let me give you an example of just how one of those worked as we kind of focus on job enrichment, the module that looked at job enrichment. So here, what we were responding to in particular was that workers were telling us that they got very little consistent feedback from their managers. They really were concerned that they didn't have a lot of information about the potential career paths that they might follow. And although site managers felt motivated to provide such kind of input, they really lacked training and resources to be able to do that. So we found some existing company materials that were really targeted at a higher level, not for line workers as here. And we worked with the company to actually modify those and develop a tailored coaching and feedback session for the site managers. Despite that, we did encounter some barriers to being able to consistently implement this. We had some challenges in terms of corporate leadership support. We also had high turnover rates, not just among line workers, but among the managers themselves, who also were facing a lot of competing demands. But to give you a sense, one of the things we actually did was a little video that provided some of this feedback and coaching training for managers as part of the training that we did with one-on-one with each of the site managers. And so taking across all of this study, what we saw was that we were able to implement these monthly meetings with site managers over the 13 months. We actually managed to do 2/3 of the planned contact points, not what we were hoping for, but still felt that we were able to at least partially trigger site managers' participation in the intervention. But we learned as well that the importance of context, that those financial pressures and competing priorities really played a huge role in terms of managers' ability to commit to the kind of work that we were doing, and that the relationships with clients were an additional barrier in terms of what was actually feasible. So this kind of gives you one case study of an example of how we might actually implement an organizational change intervention like this. What we saw made a difference is that the importance of responding to site-specific priorities based on the needs assessments that we did. We had to make a number of adaptations given the high demand environment and the nature of those challenging client relationships. We were successful in using a number of different tools that the company already had in place. It allowed us to improve the fit for the intervention that we were providing with what was already being implemented in the company. And we also worked to try to embed some of the new manager roles in their existing responsibilities in order to build their own accountability for worker safety, health, and well-being. So we might stop there and just think, how can you take this approach and tie it into what you're already doing? Thinking about the kinds of resources and tools existing within your own organization and how this might fit within the organizational priorities that you might have, recognizing that we don't have to start from ground zero in making some of these changes. So just a few thoughts on sort of summarizing all of this will allow ample time for discussion. What we're aiming for here in terms of organizational change is really improving working conditions through improvements in policies, programs, and practices. That starting small might be really a useful way of building success over time, starting and identifying those small wins and monitoring progress in order to learn from the kinds of successes that one company has already had. Those accountability and communication efforts make a huge difference within this whole process, as we've talked about throughout our conversation here. So we tend to, as we're working with companies, we really try to focus on the importance of leadership support and commitment, that openness to change and innovation, that also is followed by a dedication of resources to actually ensure success. Without the resources put on the table, it's hard to really be able to do that, but it can be piecemeal, building on these existing organizational processes to really leverage this alignment with existing priorities. We can plan for potential challenges through some of the preparations that we might do. It may mean really assessing your own organization and why this would be of value to them, involving stakeholders at all levels across the planning process, which means listening to the kinds of concerns that workers are really communicating about, and then making sure that everybody's involved with understanding what you're doing and what the realistic timelines might look like. So in conclusion, as we work with organizations, we really emphasize the importance of changing working conditions as a way of adding value for employees as well as to the bottom line. Each understanding of those working conditions that are priorities varies from one setting to another. And so starting with your own root causes and building in terms of small successes can really matter in terms of the outcomes that you actually want to see. So that means, what are your own business priorities? What are your own ways of getting things done? How can you provide a voice for employees as you're building this kind of systems approach toward a sustainable culture of health? So we started with some takeaways. I hope that through all of this, you've seen that we're trying to focus upstream by focusing on working conditions, and hopefully utilizing examples and resources that are already out there. And with that in mind, I would refer you to our website. We've published a set of guidelines on this approach that includes tips and case examples that you're welcome to lift and use as you see fit. There are other resources on our website. And I thank you very much for your participation. Ed, thank you. I see you're there, and I think we're in pretty good time.
We are, and not surprising from this inspiring talk, we have a lot of really good questions, and I will take them from the top. The first two are kind of related, but the first is what
Can I stop sharing? And maybe it doesn't matter. Go ahead.
Oh, yes, go ahead.
There. So the first one is, what organizational policy changes have you seen, or what trends have become apparent for maintaining worker health and well-being while working remotely from home? And why don't I read the second one, Glorian, because it's related. As more healthcare migrates to the home, the workplace for paid workers becomes the uncontrolled, highly variable home environment. Are there any best practices that organizations can adapt?
I think these are really good questions, and I think that it's truly responding to so much of what we are, that many of us who are working in the field of work are recognizing, that so many workers are moving to home. What does that mean for our social environment? So when we are at work and we're actually, having conversations more casually, it builds a sense of support. So I think there are, we can think about that, going back to the working condition kind of categories that we might have thought about. So what is our physical environment? Are there supports that can be provided at home to address maybe ergonomic hazards, or are there resources that give a person a proper chair, just as one example? How do we organizationally think about the way that meetings are structured? How do we help our employees who are working at home think about boundaries between work and home, and how easy it is for us to slip into almost like feeling like there's no difference between work and home. So I think it is an important conversation for many organizations to recognize that for many workers, home has become the workplace. And so how do we together think about creating that work environment that can continue to be supportive of workers, whether it's building relationships with workers in different ways, whether it's making sure that the stresses of the workload are still addressed in a recognized way that really understands that balancing work and home at the same time can pose its own challenges. So I think that some of the same principles hold. It means, how do we hear from our employees or from workers around the concerns that they may have and the way that they might be given resources and support to shape their work environment in a healthy way, or to optimize the healthy way, I guess is a better way to say it.
So the next question is slightly different, but has some overlap. As you know, the California Labor Lab is focused on emergent forms of work where people are not necessarily formally hired by a specific workplace. And the next question touches on that. How does the integrated approach look different if the work lacks a centralized settings, for example, rideshare drivers, remote workers, all the people who do deliveries of meals, et cetera, gig workers, in short.
Right. I think that many of the same kinds of principles hold, and I think that as we think about this more diffused work environment, I think it's a particular concern because it's harder. I think it's not my area of expertise, but from what I've read, it creates, the algorithms often create even more stressors. So there's a strong incentive to keep driving or keep delivering in many of those settings. So I think it may ultimately mean, how can we start to work with some of the organizations that are hiring, whether it's DoorDash or Lyft or Uber or whoever. How are those organizations thinking about how some of those work algorithms might actually drive workers to push harder? And how can we take into account some of the worker safety, health, and well-being issues that are part of that? And I think we can't, again, we need to think at that sort of more systems level to recognize that oftentimes the workers are not controlling that work environment, and many of the environmental factors are coming from higher up.
So more and more questions are coming in. You just struck a nerve here. So the next one is, do you believe that cultivating the use of soft skills could have advanced the collaborative effort between the workforce and leadership to accept organizational change?
By soft skills, you mean like communications, and is that what you're referring to, kind of? Yeah, I mean, you could see in the slides that issue of communication and collaboration across different groups and different levels within the organization is really critical. And it, obviously, in my opinion, it's the top level support is really critical. We need leaders to provide a sense that the business mission incorporates worker safety, health, and well-being. And that's our starting point to really drive many of these organizational changes. They're the ones that are going to provide the resources. They're the ones that hold the accountability. But in addition, we need workers to feel empowered to be talking about some of their own concerns, to feel that they have a right to say, these are the things that are concerning me, and I'm not going to be threatened to lose my job if I express concerns, or there is not going to be a sense of retaliation if I express concerns about my work environment. So I think if that's part of what we mean by communication, it's building that sense of trust in order to allow for participation across multiple levels of influence.
So we have several more questions in 5 minutes, so maybe these will have to be quick answers, but I want to get more of them in. Can you describe any changes implemented relating to job intensity? Was there changes in staffing or workload?
This is such a hard one right now because so many organizations are short-staffed. And I think we see this, some of our work is being done in healthcare, and we know the challenges that many healthcare organizations, among many others, are facing. Enormous challenges related to staffing shortages, to turnover. It's a vicious circle where the turnover happens. It creates more demands on the existing staff that are there. And I think it requires some new creativity for managers and employers to really think about how do we address some of these work intensity issues that really are challenging all of us as a society, so that as we go back to that sort of larger conceptual model, we recognize that some of these issues go beyond the organization to really think about some of those larger policy issues that all of us need to be addressing. I don't think I have an easy answer for that, because I share the concern around that.
So next question begins with a comment. Thank you very much for the informative and inspiring presentation. For the food service case study, the writer says, are there communication channels for the workers or site managers, company level management to report issues observed? For example, reporting culture or learning culture, since you highlighted communication, engaging participation from all levels.
There were, in the cafeterias, there was a standard huddle format for bringing workers together to actually communicate concerns with their supervisors. That would have been the manager of the cafeteria. I will say that we did observe that they weren't as regularly conducted as might have been helpful, but that again relates to some of those contextual issues around competing priorities and some of the job demands and turnover that were so much a part of the day-to-day work life. But there were channels in place, influenced, I guess, by some of the contextual factors that didn't always make them work optimally. I guess that's the best way to answer it.
So there are more and more coming in. We're not going to have time to go through all of them. A couple of people did request at least the last several slides, if not the whole talk, to get the resources that you listed on those slides, if that's possible. And I see now that we've come to the end of our time. So I know that we probably should have you back because the level of interest is extraordinary. We had well over 215 people who watched this talk. And I just want to thank you, not just for the talk, but for the work that you and your colleagues are doing to focus on what many of us consider to be the real determinants of worker health, not the individual behaviors at the bottom of your inverted pyramid, but the changes above. And I guess I'll take the chair's prerogative and just throw it out to you and the audience in closing. what role does public policy have in setting a floor under what employers can do? And with that,
Yes, I know that's something, Ed, your center and ours shares very much. And we actually have set up a policy working group because we want to make sure that the research that we're doing can inform public policy as well as organizational policy, and that it makes a huge difference to think about how policy might influence what organizations actually do and how they prioritize things. We've seen this even setting aside, building a sense of normative action around wages and how much it matters whether workers have a living wage. It matters whether our policies are part of that process, and what kinds of exposures workers might actually experience. It is driven very heavily by those policies. So I really appreciate you bringing that up. It's something
and thank you so much for such a wonderful, enriching talk. And thank you and your colleagues for the work. And we will be in touch on the policy questions.
Oh, that's good, Ed. We would like that. Thank you.
Great.
All righty.
Bye-bye.